Welcome to The Planet Forward with Preetha. Conversations for a greener future. The place where we ignite discussions and uncover innovations driving us towards sustainability. Every episode, join your host Preetha as we explore the stories, ideas, and pioneers making a real difference in our world. Get ready to be inspired, learn, and be a part of the change that propels us forward to a greener tomorrow.
Welcome back to Planet Forward with Preetha, Conversations for a Greener Future. Today, we have the privilege of hosting a distinguished guest, Dr. Lakshmi Ravikanth, the esteemed Dean of the Banyan Academy of Leadership in Mental Health, BALM. With a career dedicated to the intersection of counseling, mental health, education, and advocacy, Dr. Ravikanth brings a wealth of knowledge and experience to our discussion. A practicing counselor and an academic, she has developed a keen interest in adolescent mental health, existential therapy, and gender-based violence. Dr. Ravikanth has been instrumental in shaping the educational framework at BALM, where she has significantly contributed to creating an inclusive learning environment that integrates mental health practices with real-world applications. Her work extends beyond the classroom as she actively engages in providing supportive psychotherapy and designing community-based interventions that address critical mental health needs. Today, we'll delve into her journey that impact her work and her vision for the future of mental health education. Dr. Lakshmi Ravikanth, thank you so much for joining us today. It's such a pleasure to have you with us today.
Thank you, Preetha. Thank you so much. That was a glorious introduction that you gave, and very pleased and very grateful for that. And let's hope, the work that we have done and I have contributed to in the past 30 years being with the Banyan, from its inception, and with the BALM from its inception 2007, I will be able to, express, the couple of things that, are very important and vital to, the mental health discourse that we're planning to have today. Thank you.
Wonderful. I'm so happy and can't wait to hear all about that from you. So the first question I have is, like you just mentioned, you've been with Banyan for 30 years, right from inception, and from BALM from 2007. All this will not come, without a personal motivation. So I want to ask you, Dr. Lakshmi Ravikanth, could you start by sharing what initially drew you to the field of mental health, especially Banyan, and specifically to working with an educational framework like BALM? So I'd like to understand your 30 years journey and the 2007 to 2024 journey as well, because I really, that's what I'm so intrigued knowing, how do you find your purpose so early in life?
Okay, so Preetha, I'm going to make it as succinct as possible.
Okay.
But highlighting some key points that were very relevant to my life.
Okay.
So even before Banyan, 30 years prior to that, I belonged to Andhra Pradesh and I lived in Hyderabad.
Okay.
And I did my education, master's, and of course my post-graduation up in the north, and the counseling training in Christian Counseling Center affiliated to CMC Vellore. So my journey into mental health was accidental, if I can say so. Like you said, like any aspiring young learner and, somebody whose parents really forged the importance of education, I tried medical schooling, but I didn't get through medical school.
Okay.
Long back. But that didn't cause much diffidence or disappointment, because I had a backup alternative, which was my first alternative. And so I put the card on the table and I said, if it's not physical health, it'll be mental health.
Oh my God,
That,
wonderful. So you
that
already knew
was,
exactly what you wanted
yeah,
to
I
do.
knew and I wanted that, but I was following the prototype of a family that was full of lawyers and advocates and economists. So, in a way, you go back and say, okay, you don't want to disappoint them, but at the same time, if this has happened to you, I had a backup alternative. My family said, do law. I said, no, I'm going to go into psychology. And there was a silence, but they
Beautiful.
said,
So I think you already knew, I guess, since the universe knew what you wanted, it manifested the correct thing for you.
I was very keen, and I was 17 at that time because you have to choose your undergrad by then.
Yes, yes.
So I started my BA in psychology, and then the journey began, and I just loved it every moment. And I realized that physical health and mental health were so entwined very early in
Yes,
life,
yes,
so
absolutely.
together, so entwined that you can't really segregate them unless you want to do it pedagogically,
Yes.
and from the point of view of streaming. So that's how my journey began, and I went into mental health and did my. When I came to PhD, I did applied educational psychology because, as you said, you mentioned I was teaching also, and in a school and then in a college. Then I realized the lives of even 30, 35 years ago, the challenges in the lives of young adults or young people were quite different, including mine. I was
Absolutely. I know I
contemporary.
was born and raised in India. I know exactly
Yeah.
what you're saying.
So there were challenges, there were, hopes, there were, dichotomies that we faced in our life,
Yes.
getting married, having children, and, the works, all
We
of
all
that.
have to go through the social norms that was defined for
Exactly.
us. Yes.
Absolutely. Absolutely, Preetha. And then trying to balance a kind of work that you're doing because you want to work with people here every day in and day out and come back home and also be with people without, putting that, baggage on
And
them.
it's very difficult also, right? Because yours is like a really heavy work because you interact with people almost like every minute of your work. And
Absolutely.
not bringing that home, it takes a lot of discipline.
It does, and it also takes a lot of uh, I think in a way willpower to say that this is yourself and you have to keep yourself intact. It comes also from the realm of self-care. It's like if you don't care for yourself, how will you care for another?
Other exactly. So
You
it's
know?
like you need to first respect yourself and then
Yeah,
make sure that where you're drawing the line, your boundaries, only then you're able to do justice for both the roles at home and at work.
absolutely. Absolutely. And so preservation, also
Yes,
takes
yes.
precedence in a profession like ours. So coming fast forward, so that was the initial training, and I started the first guidance and counseling center in the Osmania University for young students,
Okay.
peers, and others who had small, personal distresses to maybe something a little more deeper and more
Hmm.
magnified, and where help was rendered not just alone by me, but by a team of my, classmates and colleagues and so on and so forth. But however, fate, as we say, or conscious choices, if I can say so, as we say, brought us to Chennai in 1991.
Okay.
And so from 91 onwards, I was doing some freelancing work in Chennai in mental health. It took time because, in 91 to establish a personal practice was not easy at all. People would
It's
not
such
come.
no way because mental health is considered a taboo in our country. Yeah.
Absolutely.
You
So
know,
the word psychologist, psychological education, counselor, however you try to water it down, it still meant that you should be mentally unwell or insane or mad in order to go and see someone like you. And even sometimes, I mean, I was lucky again enough because I met a few nice people, doctors and others, who said, this is required. We'll try to make referrals,
okay,
to
very good.
you, but you've got to take it from there. And I didn't want to hard kill. I was looking for opportunities. I didn't want to hard sell. But when people came, 1991, I'm talking about, must have been 32, 33 or something like that. And people actually peeped in. I'm giving you this because you also must understand that we have stereotypes in our profession.
Society. Yes.
So in our society, so people would come in and say, we want to meet Dr. Ravikanth. I was not gray. So I said, yeah, this is Dr. Ravikanth. Then they said, no, Dr. Ravikanth. So they were obviously expecting a man,
Man,
you know,
exactly. So because of your last name. Oh, wow.
so I would say, well, and in South, you could be Lakshmi Narayan also and a man. You could be
Yeah,
Lakshmi Ravikanth and be a man.
exactly.
So,
Yes.
so Lakshmi is
It's applicable for both
it's a
genders.
gender-free term, sort of,
Yes.
So I'm just giving you a humorous anecdote. So then I said, no, I'm the counselor, and so there were people who are a little bit older, and they said, what will you do? You're so young,
Oh my God.
and how can you help us with our difficulties? Couple of them. And I would merely smile and say, I completely respect from where you're coming. I understand your concerns. You know, we could try having a conversation maybe for the first half an hour. If you're all right with it, we'll continue. Otherwise, you will say bye-bye. So that's how I started making my inroads. So 91 to 93, it was doing some school mental health programs, college mental, more like a freelance consultant.
Consultant. Okay.
And not only in Chennai, but also going back to my hometown, Hyderabad, and missing it, and thinking that, oh, I was so confident Chennai will give me everything, and left my job, blah, blah, and all that. And but it so happened that in 1994, Banyan got established, on 27th of August, 1994.
94.
And it was not immediately that I came to know about the Banyan, but it was around the November, December time of the same year that a friend of ours, again, he was a human resource consultant, he came to me and he said, you've always been saying that you want to do some serious mental health work, and you're dabbling with a bit of counseling, training, and all of that. Here's an organization, and they were very close to where I lived in Annanagar those days.
Okay.
So would you like to
Beautiful.
go and meet these two very young, dynamic girls? Of course, very much younger than me even those days. So I said, yeah, I'd love to. And I said, do I have to take an appointment? And he said, no, just go walk in. So one morning, I just drove down to this place. Very simple. It was a house and a facility. And I didn't know what was coming because he didn't tell me. He said mental health. So when I walked in there, I saw, women, and I saw a small office. And then I said, I've come here to meet Vandana Vaishnavi. They were both there. They used to share an office at that time. And I introduced myself and I told them what I do and what I'd like to do. So then they talked to me about the Banyan and how it started. And I was astounded. I was bold beyond my belief to think that two young women,
Young girls
21,
had the
22
courage,
years,
had the
14,
courage to
15
even
years
think.
younger than me, Preetha.
I know. And imagine their courage and their vision that they could do it.
Absolutely.
That is what is completely, mind blowing for me as well. At a
At
young
21,
age.
22, at 32, then whatever, when I met them, they're, no, 14 years younger. I wouldn't have thought of 21, 22. I was doing masters, but I didn't think I'll, spiral myself into doing something like this. I mean, that is unique, and when they talk to me about
Absolutely.
Banyan, homeless, mentally ill women, I mean, I said, what are we all, I mean, at that time, and my thought was, we're all looking for careers, no doubt. We're all aspiring to do something for people through, the kind of professions we choose. But who do we really and mostly work with? The privileged and people, who have
Yeah,
more privilege.
we will never go and
Yeah.
work with the underprivileged, right?
Yeah,
Because
even in those days.
yeah, our colleagues and others are all similar education background or economic background, but we never work with
Right.
anybody below that.
And always this, have you got a good job? Are you earning well? How much, what do you take off with psychology as your background, So that kind of a thing. And I'm talking India, I'm not talking, psychology, psychiatry, and therapy in the West, where everybody needs one besides your dentist.
Yes,
So,
that's correct.
so I was enamored by both. I think my first role models, if I can honestly tell you, at my age, were these two young girls. And the aspiration, the vision, the excitement, and the hope, And it was not like they planned this, 25 years later, we'll do this. It's each day as it counts, and it counts meaningfully for the people we are working, for the homeless, mentally. And I had to understand and actually not study, but understand, gain knowledge, you know, uh, you know, um, um, uh, the context in which homelessness and mental
Happen,
illness happen,
happen.
their
Yeah.
social determinants, So I learned. I said I will volunteer. So I started as a volunteer, and I dabbled with everything, right from ward cleaning to doing floor
That's
shop.
that's the best way to learn, especially when
Yeah,
you actually joining at the inception, right? You get to
that's
wear
right.
multiple hats, and then you know
Absolutely.
the complete end-to-end operations.
End to end. So I was
And
volunteering 3 days a week, fundraising, getting, donations of cash in kind. When we were in the office, I was looking at a bit of administration, hygiene. We had few social workers, few other volunteers and doctors. We would sit together and discuss what does a multidisciplinary team look like, who does a resident, they were all residential mental
yes,
health.
yes.
Who does a resident go to? Is it the doctor, or is it a peer, or is it the nurse who takes care of her, the healthcare worker? I also took part in a rescue. That I wanted to see how a rescue happens from the street. What are the dynamics that
Wow.
happen on the street? Is there resistance on the part of the client? So that the end to end journey, the beginning journey for somebody who's homelessness on the street, getting her into a system, following the protocols, the legal processes, all of that. I was participating. I didn't initiate. I participated in all of these processes, and I understood that it's not so easy. It all seems so easy, but it
No,
isn't.
there's so much of process and red tape and protocols and all that you have to follow before,
Yes, yes.
even starting the treatment.
Yeah, yes. So the legalities, information to the police, and then starting the treatment was not the conventional psychopharmacological treatment. Treatment really began by giving her, the woman, her, basic respect, giving her good food, cleaning her up, getting her to wear nice clothes. So more of befriending, if I can say so, in the beginning,
You're
that she's
gaining their
treated.
trust, right? First, it's to
Absolutely.
gaining their trust because if
Absolutely.
they're already going through a lot of trauma, and
Oh,
so
yes.
if you want to treat them, they may not even accept it because they're only going to go with their past experiences, saying that somebody else is going to take advantage of them
You-
again.
You're
So
bang on. Yeah,
yeah, the
you're
first
right.
and foremost thing is to gain trust. And then
Absolutely.
once the trust is established is when they'll even be open to therapy or whatever modality that
Right,
you're opting
right.
for, what they need.
Yeah,
So that's where I'm so much in awe, right? Because all that requires patience, Dr. Lakshmi. It is not easy because it's not like going and sitting in an office to a 9 to 5
no,
job.
not at
It's
all.
not predictable, right? Like in your office, you know
Absolutely.
exactly what your day to day will look. But here, like you said, your every day is different for you.
Totally true.
You cannot even envision, oh, this is how it's going to go. You just have to go by the minute. And
Right.
having that thing, oh, whatever comes, I'll take it. Like, all our spiritual process says, live for the day. But you guys are actually a living example of that. You live for a day. You're not
Right.
even knowing what is coming next. So that's what is
Yeah.
amazing.
You live for the moment. You also plan for the future. You also
Yeah.
think about, how do you balance both today